Good afternoon. Welcome everyone to our Ask the Experts today. All right. We are so thrilled to be joining you again for the month of June. This is our first of two Ask the Experts. So we're really excited because today is a special Ask the Experts. As you probably know, we love to highlight our partners in the nonprofit and advocacy space. So today is a partner spotlight segment, learning all about the amazing people that do work in the cancer community. So I am so excited to be joined and to share more incredible work. But until we get there, let me introduce myself. My name is Erin Pellegrin. I'm our Senior Director of Culinary Nutrition and Education. You often see me leading our segments along with our host, Sue. We've got so much more to come for the month of June, and hopefully you'll be joining us for different segments. So before we get started, again, we'll be joined and we'll be covering the amazing organization Advocates for Community Wellness. This is an organization in Chicago, and we are so thrilled to have Regina joining us today because we just hosted our first national wellness orientation in Chicago. If you've been following along on Facebook, you may have seen some pictures. So we're really glad to have her with us. Before we jump in, I will say you may be tuning in as we're streaming live on Facebook. So if you are watching us live, feel free to add any questions in the chat, or if you are connected with Regina and you've received services, please share that experience with us and share with others. We'd love to hear how this amazing organization has supported you. We know there is so much crossover between Unite for Her and Advocates for Community Wellness. So we look forward to hearing your experiences. Of course, we could not continue to bring you these amazing education events without the help of our sponsors. So I want to just quick share my screen because we, of course, are so grateful to our amazing education sponsors. They allow us to continue to bring incredible speakers, experts, organizations to the Unite for Her community. So today's Ask the Experts is presented by West, Merck, Lilly, Gilead, and Novartis. We have additional gold sponsors from GSK, Pfizer, and Daiichi Sankyo, plus additional support from Agendia, Tercera, and AbbVie. So together, we are working hard to serve the cancer community, and we are so grateful for their ongoing support. Again, feel free to add those questions or comments in the chat. And before we bring Regina on, this is not the end of what we have to look forward to in the month of June. So today is a twofer. So we have our Ask the Experts today, and then this evening, we will have our speaker series. So that is hosted via Zoom. We'll be popping that link to register tonight at 6 o'clock. We will be focusing on lymphedema management. So I know this is a topic we've covered in the past, but it is an important one. And so I love having a speaker come back to share and just reiterate some of that information about how we manage lymphedema, reducing risk of recurrence, how to manage it if you are someone that's developing lymphedema. And tonight I will be joined by Dana Torregiano. She is with Moving Forward Wellness. She's a lymphedema specialist, and she'll be talking all about lymphedema, how to manage it in various stages. She'll be sharing her experience in working with her patient population and what new strategies patients have in order to keep it at bay or keep that under control, or again, just reduce risk of overall recurrence of lymphedema. So again, that'll be our speaker series tonight, 6 p.m. Eastern time. Please be sure to join me. But as always, if you can, it will be recorded and available in our UFH Connect video library as early as tomorrow. So you're always welcome to come back, re-listen, or share with someone that you know may benefit from that. So with that being said, let me introduce our special guest for today. Regina is truly amazing. So Regina Hopkins is a dedicated family nurse practitioner serving the South Side of Chicago. She holds a master's degree in advanced nursing science and brings more than 18 years experience in the healthcare field. Her clinical expertise spans women's health, cancer awareness education, and a focused commitment to chronic disease prevention. She's conducted international research in Thailand, where she explored issues related to body image, self concept, and personal health behaviors among adolescent females. And for the past decade, she has served as the Director of Health Education at Advocates for Community Wellness, managing the cancer awareness and survivorship support programs, as well as the Well Woman Wellness Program. Love that. Her work centers on advancing health education and promoting health equity, particularly in medically underserved communities. But not only that, and I'm not sure how she finds the time for this, but in addition to that, she is an accomplished author. So her works include Grow in Grace, My 30 Days of Devotion with God, a spiritual devotion, as well as Salt, Sisters Accelerating Lives Together, a collaborative collection of inspirational stories about four young women who, as evacuees of Hurricane Katrina, find hope and healing through faith amidst adversity. I don't know how you do it, Regina, but I'm glad you are joining us today. So please join me in welcoming Regina Hopkins with us today. Thank you so much for being with us.
Thank you so much for having me. And I just wanted to say thank you so much. Shout out, of course, to Unite for Her. You guys have been such a great asset to our cancer community, connecting with you and Nina. Our patients really do love your wellness program. That passport is everything. That gift box is everything. And we're just so thankful to have partners like you to help us continue the work that we're doing.
You're so welcome. And you know what? This is the time when I always hear Sue in the back of my mind, and she says, "We are better together." And we truly believe we are better together. And so this is why we love to have community partners like this on with you. So I'm so grateful to be able to be in this space with you together.
Yes, thank you.
You're welcome. So why don't we jump in? Let's start with the basics. So why don't you share and provide clarity again? I know I sort of covered this in your introduction, but the mission of your organization, what is that foundational mission?
So the mission of Advocates for Community Wellness, we've been around, we celebrate our 21st year anniversary this past year. So we've been in existence for quite some time, but our mission is to reduce health disparities, to increase health literacy, and to promote health equity in underserved populations. And we do that through the education of healthy lifestyles, fitness, and proper nutrition. So in a nutshell, our goal is to reduce risk for chronic conditions, as well as to help families and individuals in medically underserved communities manage those conditions, as well as also to provide resources to be able to live healthy lifestyles, because we know it's one thing to share information on what to do, how to do it, but you need the tools in order to be able to be effective. So that's what we're.
Yeah, I love that. And I know, we heard in your introduction that you do a lot of work specifically with the cancer community, but Advocates for Community Wellness move beyond the cancer space. You're looking at all sort of health comorbidities and conditions. Is that correct?
Yes, so we operate under a wellness initiative. It's called Healthy Families Equals Healthy Communities. And under that umbrella, we have our four signature programs. And those programs include first our nutrition program. It's the ADU program that's managed by our founder, Dale Kane. We focus on plant-based nutrition. I always say that our goal is not to push people to become vegan, but we do want to encourage the increased consumption of those fresh fruits and vegetables, whole grains, the foods that we know that are going to work best for you. So in that nutrition program, we offer cooking classes centered around the plant-based recipes. And the goal is just to provide education on how important nutrition is to reduce chronic conditions such as diabetes, heart disease, and cancer. But also, if you have a chronic condition, how to better manage that condition with nutrition and other healthy lifestyles. So that's the first program that we have. Our second program is our Cancer Awareness and Survivorship Support Program. That program has two components. With that particular program, we do a lot of outreach education within many communities in Chicago, not just on the South Side, but just the Chicagoland area, where we focus on education to bring awareness about the importance of getting those routine screenings, timely cancer screenings. Our goal is to really provide education on mainly breast, colorectal, lung, cervical, also endometrial cancer, and prostate cancer as well. So we do outreach education, wellness workshops, lunch and learns, speaking about the risk factors for these types of cancers, how to include healthy lifestyles to reduce risks, but also to get those screenings on time. And in those
I love
workshops, we
that.
do collaborate with a lot of healthcare facilities to link our community members to facilities to get those screenings if they have not had those screenings. The
Wonderful.
survivorship support piece of that program, of which I manage, is our Along the Journey program. We provide a 9-week virtual course similar to the education that you guys provide. So within the 9 weeks, we offer education on nutrition, emotional wellness, and physical fitness, because we know that those three components are very crucial to survivorship and to reduce reoccurrence. So
Yeah.
that program is virtual. It's offered 3 times a year. We started the program through a grant from Gilead Sciences, a pilot program about 3 years ago. That was our first cohort. And this past month, we've entered into our 10th cohort. So we've had numerous of women to enroll into this program to get those supportive resources and education to help them, no matter where they are in their journey, whether you're just being diagnosed, whether you are going through treatment, whether you're 1 year out, 2 years out, 5 years out, 10 years out. The goal is to provide support as well as to provide you tools and education to reduce recurrence and to help you on the journey, no matter where you are on your cancer care
Yeah.
journey. So that's the
Yeah.
Along the Journey program. We also do cooking classes for the past year. We've been doing cooking classes thanks to funding from the American Cancer Society. We've been able to do some cooking classes through our Fighting Cancer Together program. And that particular program is open to anyone with any type of cancer diagnosis if you've been
Mhm.
diagnosed within the past 5 years. So the goal of that cooking program is to provide healthy plant-based recipes. We have a cooking demonstration. We do a food tasting, and the participants get a food voucher to purchase those food items for the recipes that
Oh,
we
I
provide.
love that.
Yeah. So our June series is kicking off tomorrow. So it's a three
Mhm.
week course. So each week we cover different educational content. But we also find that beyond just the cooking and the great food that we're able to experience, there's so much support that the survivors are able to just exchange amongst each other. So it really has become like a family for those who are just looking for someone, who knows what they're going through, no matter what stage they're going through. They can come together, have
Yeah.
a great meal, a great time, and
Yeah.
still get some great insight as well. So that's
And
our
I will
Fighting
tell you,
Together
I will
program.
tell you, yeah, that it's similar to the cooking classes that we offer as well. We hear that
Mhm.
same sentiment that, the recipes and the hands-on and the tasting and the learning are great, but it's the coming together. It's
Mhm.
the seeing a lot of the same people, it's the collaborating, it's the sharing that becomes a little bit like a support group in and of itself. So I
Yeah.
love hearing that.
Yes, yes. So that's the cooking classes for the cancer survivors. So we have many cooking classes. We have a cooking class for the general public, just for
Right.
chronic disease prevention and management, and then we have the Fighting Cancer Together cooking classes. So those are the
Amazing.
first two programs. Our third program is our Well Woman Wellness program. That program was centered around just providing outreach education to women to encourage them to not forget to get into the clinic at least once a year to get those annual screenings. We know women wear many hats. We're mothers, we have careers, you can juggle so many different things, but
A
many
lot.
times we tend to put ourselves on the back burner. And for some women, that means missing that annual appointment to get that well woman exam. So we do workshops, lunch and learns, outreach events, just encouraging women, make sure that you get in for that well woman exam. There's so much that goes on. You get your blood work done to check for the different chronic conditions. You get your cancer screenings. So we provide that education to encourage women to get those annual checkups, but also we link individuals who are in need to other resources that may be to address some of the barriers that they may face from getting into the clinic. Not
Yeah.
having insurance, well, I don't have
Yeah.
childcare, I haven't found a medical home yet. So we try to look at what are some of the barriers that women face. Transportation. I don't have a way to
Hmm.
get there. So we try to address those barriers with resource support, such as providing maybe a gift card, Uber gift card, or a transportation vouchers to get to a scheduled medical appointment, but making sure that they've gotten in to get checked up. Okay.
Hmm.
And then
Hmm.
the final program we have is our mental health program. Mental health is,
Oh,
is such a big topic that needs to be covered everywhere in every community.
yes.
But really just, we're providing education and outreach, especially in the communities that we serve, to remove the taboo that's attached to mental health. That's usually a topic that no one wants to talk about. So we do a lot of outreach, letting people know that, it's okay to not be okay. Help
Yeah.
is there if you need it, but also to
Yeah.
encourage people to reach out if they need help, and to understand that everyone has mental health.
Hmm.
Having a mental illness is different from having mental health, but I have
Hmm.
mental health, you have mental health. It's just the state of our mental well-being. So,
Yeah.
we have good days and bad days, but just learning how to manage those days to make sure that you're able to be the healthiest version of yourself possible. So
Oh
we
my
do
gosh.
resources and workshops centered on mental health. So in a
Amazing.
nutshell, that's a lot of what we do. We do
In
quite
a
a bit,
nutshell.
for
Oh
a
my
small
gosh, you
nonprofit
do.
organization, but we are
Yeah.
reaching the communities with that health
Definitely.
education.
Oh my gosh, you're reaching the communities in so
Yeah.
many different ways. And so a lot of the workshops that you do, it's a mix of, am I hearing this right, virtual, maybe in
Hmm.
person that you're hosting, and then on location at places in the Chicago
Hmm.
area.
Yeah, yeah. So
I
like I
love
mentioned,
that.
we do workshops, we do lunch and learns, we do resource fairs, resource tabling, the cooking classes. We go
Mhm.
into churches, we go into community centers. If you invite us, we show up
I
to do
love
what we
that.
do, you know.
I love that. And
Yeah.
the experts that are helping you with all of these various programs, are they specialists in mental health or women's health, or who are the professionals that are helping you?
Yeah. So a lot of the education, a lot of the workshops I do lead myself.
Okay.
I have a background in health education,
Yeah.
but we do
Yeah.
reach out to a lot of our community partners, who do have health educations, who are experts in those particular fields. So we
Love
have
that.
nutritionists that we work with. We have social workers that we work with. We have doctors from facilities that we work with. So, individual stakeholders in the community that we work with. So, we invite those individuals to our workshops. A lot of them do lead our sessions. They lead, provide educational content, because many of them are trusted resources in the community. So, to see a
Yeah.
familiar face, more than, is the community is more, how should I say, more willing to receive that education when you see a familiar face that that's in your community. So they're considered trusted
Absolutely.
resources in the communities that we serve. But
Yeah.
yeah, we work with a
Yeah.
lot of community partners because we know, as you know, this work cannot be done alone. So, to
Right.
rally around individuals who have a similar mission as ours is our goal
Right.
to provide the education that we offer and the services that we
I
offer.
I love that. I love that. So in terms of eligibility for your program,
Mhm.
can anyone access it? And I guess that really depends on the program in which they're interested in, or is there some overlap in terms of, what a person may tap into? Who would be able to reach out to you for support?
Yeah, so anyone can reach out to us for support. For our cancer programs, we do have some of the programs are specific to like a certain diagnosis or a certain
Right.
group. So, say for example, the Fighting Cancer Together program,
Yeah.
that is limited to those who've been diagnosed within the past 5 years. The
Okay.
virtual cohort that we provide for the Along the Journey, that is a women's cohort. So, women with any type of cancer, breast, lung, colorectal cancer, can enter into that cohort. Our workshops are open to the public, so any and everyone can attend any of the open workshops or the lunch and learns that we do.
Great.
The women's health programs that we do, I mean, it's for women's health, but anyone can attend. If you can
Yeah.
take that information and take it back to a loved one, so you may be attending on the loved one's behalf. So,
Yeah.
yeah,
And any age. So even
and any,
teenagers, I'm thinking like even our
oh yeah,
younger female generation can come in and learn about women's health. So
yes,
open to
yes.
any age.
Open to any age. And actually, we've had, especially when we do like the outreach for the women's programs, we have mothers who bring their daughters or, bring their loved ones. There's a variety of ages that come because I'll definitely say that you're never too young to learn how to be healthy, and that's
Right.
really the goal when talking about targeting the family.
Right.
So yeah, so our workshops, the outreach events that we do are open, to the public, so anyone can come. Mhm.
Amazing. Amazing. And
Yeah.
for your mental health program, did I hear that correctly? Are you looking at sort of a young adult adolescent age, or is that a program that is for everyone as well?
Oh, so that program is for everyone as well. So that
Okay.
education that we do is just open to the general public. Anyone can come. It's just general education on, wellness tips on how to maintain mental wellness, strategies to reduce, things such as like anxiety, depression, coping mechanisms, just understanding what mental health is in general, but also
Yeah,
too, providing resources, locally that are in the community, that many
yeah,
people may not be aware of that exists in the community, not knowing
yeah,
that, oh, this particular building I passed by 5 times a day, they offer these services. So just,
right.
tapping into the local resources that we have and connecting community members with those resources that can support their well-being.
Yeah, I love that. And we hear that so often. I hear that so often from when I'm connecting for consults or we're at live events, and they're asking, do you know an organization that does this? Or I need help with that, or what is available? And being able to just bring awareness to what else is out there and
Mm,
who is offering different services is such an
yeah.
aha moment, right? It's like, I had no idea that this type of support was available. So you're right. Just even being able to share what else is available in the
Yes.
community virtually, through all different types of access is I think just um, takes it so much further. Is that additional step further?
Mm-hmm.
Yeah.
Yeah.
I love that. Okay. And I know you're based in the south side of Chicago. I'm hearing,
Mm-hmm.
you do a lot of in person. Talk to me about geographical area in terms of who can access, with a lot of virtual. Is it open to those outside of the Chicago area, like the greater community? Who is eligible to sort of tap in from a location standpoint?
Yeah, so anyone, like I mentioned before, our events that we have are open to the public. So we've
Yeah.
had, and even with our cooking classes, I'll just start with our Fighting Cancer Together cooking classes. Now, because we're based on the South Side, the target communities that we serve are the Auburn Gresham, the Inglewood, West Inglewood, the
Mm-hmm.
Roseland, the
Mm-hmm.
Washington Heights, Morgan Park community.
Mm-hmm.
Um, but we've had individuals that come as far as South Holland, from the far south side. We've had individuals that come from the suburbs, from the far north side. So,
Mm-hmm.
if they're willing to travel, I'll just say, come join us.
Yeah.
So,
Love it.
no one's, we don't, not welcome anyone. So if you're willing to
Yeah.
travel to meet us where we are, please come. So all throughout the Chicagoland area. So I believe there's 77 different communities in Chicago. So we've had individuals come from the far north, from the far south side,
Mm-hmm.
even beyond the
I
Chicago
love it.
area. Like I mentioned, we had people in the suburbs to come out to our events and to attend some of our classes. So if you're connected with us, we have a following. When we do events, individuals come from near and far to show up, to support. So
Mm-hmm.
yeah.
Mm-hmm. Absolutely. And I will say, hopefully, the next time we're in Chicago for our next wellness orientation, if you have a cooking class, I would love to join and come
Oh
and cook
yes.
and taste. That would be so much fun to
Yes.
be on the
Yes.
receiving end and cook along with your team. Oh my gosh, that would be so much fun.
Yes.
Yeah.
Yes.
Yeah. And I'll tell you, we have a large number of members that are in and around the Chicago area,
Mm,
and many, many, many are already very well versed in your organization and familiar with it.
mm-hmm.
And frankly, are excited to see that oh, you know about them? Oh, you're working. Oh my gosh, I'm so excited to see that you've already connected with Regina. So you're right. We hear it that
Yeah.
you have a really strong following, which is great.
Mm-hmm. Yeah. And
Okay.
we're thankful for just the continuation, those who've been with us for years, since we started the programs, they've stuck with us. And like I said, wherever
Yeah.
we are in the city, they travel near and far to participate in whatever events that we have.
Yeah, wonderful. And I know that we'll be putting the link to your website in the chat. So those
Hmm.
that are interested or want to pop in virtually, if it's a little far from you, can get an understanding of, what's coming up, how they can join, how they can get connected with your organization. So we'll definitely be sharing your website as well as all of your social handles to follow along on Facebook, Instagram, all of that. So I know that we're popping that in because I think everyone's going to want to keep up with you and what you have coming up. There's
Yeah.
so much to tap into, which is great.
Yeah, and also just speaking of events, May is, I'm sorry, we're in June. June is Men's Health Awareness Month. So this Saturday, we are having a men's health breakfast.
Love that.
It's going to be located in the Auburn Gresham community.
Mm-hmm.
It's on the corner of 79th and Halsted at the Auburn Gresham Healthy Hub.
Right.
So, and it's not just for men. So we say, women bring the men in your life, because we know that once again, women are, the drivers of the home. So a lot of them just take information back to their families. But we'd love
Yeah.
to have you to join us this Saturday for our men's health event. I can just share
I
that
love that.
information. That's going to be this Saturday, June 14th from 10 a.m.
Wonderful.
to 11:30. That's at the UIC Neighborhood Center. That's 839 West 79th Street. That's in the Auburn
Perfect.
Gresham community. And it's open
Perfect. And that
to the public. We have a flyer
good.
on our Facebook page if you're interested in registering for that.
Mhm.
But we would love for you to join us.
I love that. I love that. And I'm so glad that you're focusing on men's health as well, because, two reasons come to mind. One, what you said earlier, even for our younger generation of boys and teenagers coming up, getting them starting to think about their own health and long term. So even having something like this available for families to bring young boys in to start just thinking about taking care of themselves, but also, Unite for Her, we're also looking at male breast cancer, so even
Mm,
bringing awareness to that cancer in general, just
yeah,
outside of even the scope of just prostate cancer or some that
yes.
are, strictly for the male gender, but awareness overall. I love that you're calling that out and you're having events like this. This is great. So we'll definitely be sure to share that event. And I know you have a summit coming up in
Oh, yes,
September that
yes.
we'll put a little bit of a teaser out. But if you want to share what's coming up at the end of the summer, and what those in the Chicagoland area can look forward to, it sounds like a pretty fantastic event.
Yes, so please do. Definitely, you have our link to our Facebook page. It's a great way to, you know, um, stay abreast on the different things that we're doing, and also to just being able to share the website because we post a lot of our events that we do on our
Yeah.
website. But so yeah, this year we're going to be having our second annual. It's our E3 to End Cancer Summit. We had a very, very great turnout last year for our first cancer summit. So the goal of this summit is to provide education for awareness and survivorship. And just E3, that stands, the three E's is for empower, eliminate, and equip. So this year we're
I love
focusing
it.
on fighting cancer and health disparities, and we're looking at it from the lens of access to healthy foods, because we know that when you have lack of access to healthy foods, you're definitely at higher risk for chronic conditions, including cancer, because nutrition now is being linked to so many conditions, especially cancer. So, we see that a lot of education is not being centered around food when we're talking about reducing cancer risk, but also to reduce reoccurrence as well. So, our
I love
second
it.
annual E3 Summit, we have between over 20 vendors that come out that offer wellness supportive services centered around not just cancer, but just things that address the social determinants of health, wraparound services. It's a family event, so anyone can come to that event, not just the cancer survivors or people who've been diagnosed with cancer, but it's about awareness also on prevention. So we're looking to
Yeah.
have that event in September, so stay tuned. You should be seeing some flyers soon about more information on the location of that event. But we are so excited to be able to put on this event for our second year because we had such a great response from the community last year.
Oh, I'm sure you did. And I love the focus this year. And I love, of course, as a dietitian, I love anytime we're bringing nutrition awareness and education in it. But 100% agree with you, Regina. We're often seeing this overlap of whether or not you have a cancer diagnosis, there may be other health conditions going on. Even when we
Mhm.
talk about nutrition education, I love that plant-centered approach that you take. That
Mhm.
also supports heart health, kidney health,
Yes.
bone support. So there's so much overlap, and everything is so tightly connected that there is that domino effect when you start to focus in on hydration and how to access
Mhm.
healthy food and how to make them, a tangible resource for our communities.
Yes. Yeah. Because many people, whether people know it or not, don't have access to not
Yeah,
even just healthy food, but just food in general.
food.
There's such
That's it.
the food insecurity is a big issue, especially in
Yeah.
medically underserved communities. But yeah, so that's the
Mhm.
topic that we're going to be discussing in
I
this
love
year's.
it. I love it, love it, love it. Good. So everybody stay tuned over the summer for flyers and information coming about that summit in September. Now, with that being said, let's talk a little bit about the work that you do to fund your program. So, for those that are looking to join, is there any fee or service, or how do you work to get funding to continue to support your program?
Yeah. So like any nonprofit, we are funded through sponsorships, community donations, and grants. Okay.
Yeah,
But with that being said, all of our programs are free. We don't charge
great.
for any of our programs. The cooking classes are free, the workshops are free, everything that we do is free. And we're
Great.
able to do these programs free of charge because of the generous donations from funders that we receive. And we're always looking for community partners and sponsors to help us to continue to fund our
Yeah.
program. So, yeah, sponsorships, grants, community donations are always welcome. But as you know, for a
Always.
nonprofit, that's how we
Always.
operate. It's through the
That's
support
right.
of the
Keeps that
community.
mission going forward. You got it.
Yes,
You got
yes.
it. So, with that being said, in that light, I always think it's important to share for those of us working in the nonprofit space, what are some of the biggest challenges you are experiencing currently in the work that you do? Is it, continuing to gain the funding, keeping up with demand, reaching those different communities, all of the above? What do you feel like are some of the biggest challenges, just to bring some context to those that are watching, and also I think it really compels the community to continue to support our nonprofit organizations. But what would you say are some of your biggest challenges?
Well, I mean, at the top of the list, I believe for any nonprofit is the funding. You
Yeah.
can't continue the work that you're doing without funding. Funding is so crucial. And even when you have volunteers, we do rely on volunteers for some of our programs,
Yeah.
but
Yeah.
um, you know, that can be very limited. So in order to keep things running, to keep programs running, funding is very essential. So I would
Hmm.
probably say one of the biggest challenges is just getting continual funding. And also
Hmm.
too, we receive a lot of funding for just programs, but having access to unrestricted funds because we know beyond the programs, you have other operational costs, administrative costs
Hmm.
that some of
Absolutely.
the grants that you receive are only for the programs itself, but those other operational costs, what do you do with those? So just
Yeah.
being able to receive, so be able to secure funding, each year to continue the programs. And also when you're talking about program expansion, to reach more people, more communities, more
Right.
funding is needed for that because you're going to have to increase your capacity in order to be able to reach, you know, more
More
communities
people.
that are in need of the same
That's
services that
right.
we're providing right now. So
That's right.
that would be at
Yeah.
the top of the list is just securing continual funding each year. And also
Yeah.
not just continual funding, but having more funding to come in to be able to expand
Yeah.
programs. Mhm.
Yeah, yeah, it feels like that need is ever growing, right? And that demand is always getting larger. So, right, how can you continue to gain that ongoing support, ongoing donation, sponsorship, partnership, all of that for sure. So, with that being said, how can people get involved or support your mission or make donations? How can people support you?
Yeah. So please visit our website. Our website is www.a4cw.org. There's a tab for our support. So that will be www.a4cw.org/support. And there's a tab to donate if you're looking to donate to the organization for any of our programs. Also, we welcome volunteers. So there's a contact button on our website that you can contact us and reach out if you're looking to provide, if you're looking for volunteer opportunities, you can
Yeah,
provide that your information, just leave, an inquiry that you're looking to volunteer. Yeah, so visit our website. Once again, that's www.a, the number four, a4cw.org to learn more about our
wonderful.
programs as well as ways to support our organization.
Wonderful. And I'm sure we'll put that in the chat on Facebook as
Yes,
well so
please do.
everyone can pop into that. Oh yeah. And we'll tag
Yeah.
you on Facebook. And it's also good to know, for organizations or companies that are in and around the area that may want to host a workshop targeting a
Mm,
topic that you offer, they can reach out to you, they can educate their
yes.
employees,
Yes.
support employee health. So even bringing you
Yes.
in and be able to support you in that way to educate and serve their employees, I think would be perhaps a great outlet as well. So even companies and organizations in and around the Chicago area, like, you do great work, it can serve
Yeah.
so many.
And thank you for sharing it because we've actually in the past we've done some wellness at work workshops, centered on the well-being and health of the
Yeah.
employees because we
Yeah.
know that if your employees aren't healthy, the company can't run. So
That's
we've
it.
done workshops, and we welcome that opportunity, more opportunities like that to do, wellness workshops. We call it wellness at work workshops,
Yeah.
centered on employee wellness, health and
Yeah. I
wellness.
love that. I love that. Just dropping that
And another
seed
way
for
too,
you.
just
Always,
to stay
always thinking
connected.
about it.
Yeah, as you're sharing our link, if you're, like us and follow us on our Facebook page, you'll be able to stay engaged with the different programs that we have. Once again, we do a lot of programs, a lot of events. We are, in the community, several times a week, doing outreach. So just
Hmm.
to be able to stay engaged and to see what we're doing, on a monthly basis, definitely follow us and like our Facebook page, which I know Erin's going to share
Yeah.
later.
Yeah. Absolutely. Yeah. And to see where you are showing up all over the area because you are clearly everywhere, but it is needed. So yeah, for those to
Yes.
stay connected with where you're going to be and how to connect with you and how to serve you and support you for sure. All of that is
Mhm.
going into our Facebook page. And I know as part of our Unite for Her resources that we have on our website, Advocates for Community Wellness is there as well. So we are always sharing that with our community and for those in the Chicago and surrounding area. So we are so grateful for you and the work that you do, Regina. And I am tired just having you here. So I am grateful for you taking the time to share your mission, to being with us among the very busy work and needed work that you are doing. So just know that we
Thank
are so
you.
grateful for your time today.
Thank you.
You are very welcome. So be sure to visit Advocates for Community Wellness, pop into their organization, follow them on social, support all of us that are working in the advocacy and nonprofit space because truly we are better together. So, Regina, thank you so much for being with us
Thank you,
here
Erin.
today.
Thank you for having
You're
me.
welcome. Of course, of course. What a wonderful segment, right? And again, I say this: we are better together, and we are so honored to be able to bring to light others that are also doing incredible work, not only for the cancer community but for health overall. So whether someone has a health history or not, this is something that we can all lean into, help our neighbors, help our community. For the greater good. So really glad to showcase that this afternoon. Hopefully, I will see many of you this evening for our speaker series. Again, that will be taking place at 6 p.m. Eastern Time. We're talking all about lymphedema management. So be sure to join me. It'll be a great learning opportunity and some time for discussion. So we're really excited to jump into that as well. And then finally, I want to give one quick thanks again to our education sponsors because they are helping all of us and continuing to bring segments like today to our Unite for Her community. So today's Ask the Experts, part of UFH Connect, is sponsored by West, Merck, Lilly, Novartis, and Gilead Sciences. Plus, we have additional support from our gold sponsors, Pfizer, GSK, and Daiichi Sankyo, plus additional support from AbbVie, Agendia, and Tercera Therapeutics. So thank you so much, everyone, for joining us today. If you are in and around the Chicago area, please connect with Regina and Advocates for Community Wellness. Tap into the amazing work that they are doing. Hopefully, I will see all of you again soon, and everyone enjoy the rest of your Thursday. Thanks so much.
Thank you.